You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic dentures. According to my first guest, he says if you have to have a denture, then you better have a cosmetic denture. With us, we have an expert on the topic. We've had him on the program before, Dr. Brendan Dwyer. Dr. Dwyer, welcome to the program. Welcome back.
Yes.
It's been about 3 or 4 years.
Exactly.
And interviewed you on what you're doing with gum disease and laser dentistry. So, cosmetic dentures. How long have you been involved with cosmetic dentures?
Oh, a good 15 years.
15 years. What do you call them? I guess you have a name for them.
Well, the lab has a name. The lab that came up with it is a cosmetic lifelike system.
What do you call it with patients?
Just natural. Natural looking dentures.
Natural looking dentures.
You know,
okay.
Dentures that look like teeth, not dentures.
Okay. Now, you brought a lot of photos, by the way, and I think if anybody's watching this, very dramatic. I mean, these are lifelike looking dentures.
Correct.
But for people that don't know your practice or what you do, tell me a little bit about your practice, the different procedures that you offer or services you offer in your practice.
Well, living in Fort Myers, my typical patient is older.
Okay.
The kids in my practice are 60.
Okay.
So we're dealing with a lifetime worth of issues in the mouth. And when I say issues, it's not bad things. There's a lot of good things going on. But there's some things that can be addressed. Cleanings. Everybody needs cleanings. Whitening. Whitening's important. We do crowns. We do bridges. We do dentures. We do a lot of dentures. And as we discussed at the last meeting, the laser gum treatment, because people know I have the laser.
So no more gum disease, right?
Well,
that's what we talked about in the last show.
We're controlling it.
Controlling gum disease. Okay, good.
Gum disease is one of those things. Once you had it, you're probably going to have it for life. You just got to control it.
Okay. Okay, good.
Once we get people in shape and they come in regularly for cleanings, we can hold on to teeth. We can make gum disease go away or put it at bay.
All right. Now, we invited you on the program to talk about these cosmetic, natural-looking dentures. You say that in your town specifically, like let's say within an hour of your practice, there's a lot of people wearing dentures. Is that correct?
Correct.
Like how many would you say? Like 1,000?
Oh, more than 1,000.
Thousands of people with?
Thousands, yes.
And
you know, the Fort Myers area is 450,000 people.
Okay.
But I don't know the percentage of dentures. I know there's studies that show that as we age, the baby boomers like me, fewer of us have dentures. We have our own teeth compared to the generation before us, but there's still a lot of dentures out there.
Now, I feel like I could spot dentures, a person with dentures, from about 10, 15 feet away. But you say that if, with these natural dentures, I couldn't tell. They look natural.
Correct.
Is that right?
Correct. The other thing, me as a dentist, when I'm in a restaurant, I can tell somebody that's wearing a denture by the way they're eating.
Oh, really?
Yeah.
Okay.
You don't go side to side with dentures. You go straight up and down. And that's why the system that we have helps people chew.
Okay. Okay.
So they're not as compromised in keeping up with the other chewers at the table that have teeth.
Now, jumping right into it, you brought a lot of photos.
Exactly.
So which one would you like to start with? What are we looking at here?
Well, this is a favorite patient of mine. He came in from the laser marketing that we did the last time.
Okay.
And he just wanted to get his mouth in shape. So here he is.
Okay. He looks pretty serious.
I asked him to smile. That's a smile. You know, me being a dentist, smile, I'm hoping to see some teeth.
Okay.
He was having issues with his lower teeth. He had natural teeth, removable teeth, and it wasn't working. So he said, let's work on this first. So we went ahead, we got the lowers in shape. After that, then we had a rapport. He knew what kind of dentistry we were doing. And he says, okay, now I want to see what you can do on top. So then we addressed the top. His main intention was the lower arch. We got that in shape. He saw what we could do, and he says, okay, what do you propose for the top? And while he did have a few teeth up there, they weren't in a great location. So what we opted to do there is an implant-supported denture.
Okay.
This is one where the implants were placed, a bar was placed on the implant, and then the denture snaps on the bar.
All right.
It's something to take out at night, but you got the roof of the mouth open, and you got solid teeth. He was telling me when we first put the denture in, he almost couldn't get it out.
Is that right? Hard to pull out.
Right.
Let me take a look at it. So that's him.
This is him afterwards.
Wow, what a difference.
Yes. I always like it when somebody gets rid of the mustache after we fix their teeth. somehow there's a compliment in there. When we started and I asked him to smile, I didn't get any teeth.
That was it. That's his smile.
Right. Well, that's what I asked for. You know, it is a dental office, so sometimes I don't bring out the smile.
Right.
But, you know, it's also he's gotten to know me, but I definitely have the smile in the second picture.
Yeah.
He's mentioned to me that friends of his just say, "What have you done?" You know, and they're trying to figure it out. And it's true. When you address the mouth, people don't know what you did.
He looks younger, by the way.
Yes.
When you look at the before and after, he definitely looks younger. He looks like a nicer guy.
Mm-hmm.
You know.
He is a nice guy. So now he looks like the guy he is. You know, the staff is all, you know, they love him. You know, he's a great guy, very appreciative, and we're appreciative of him.
Now, what do you call this? Like a snap-on denture, an over-denture?
I call it implant-supported denture.
Implant-supported denture?
Mm-hmm.
Now, the dentures you make, and we talked on the telephone, you say that these, unlike traditional dentures, these are hand-painted, the gums.
Right.
To make them look real.
Let me show you this denture here. It's easier to work with the picture.
All right, all right.
This is the sexy arrangement. In this, there's going to be more curves because it tends to be more
What do you mean
for females.
sexy arrangement?
We have about 10 different setups of teeth.
Okay.
And the sexy one is the one that's geared more towards females because there's more curves, angles to the teeth. The central incisors are slightly longer because they're not worn down. And the canine teeth still have points on them.
Okay.
If you look, you can see the canine lateral triangle.
Nice.
And you see nice little curves here.
On the two front teeth.
Well, really, it's the four front teeth
Oh, okay.
have curves. You know, rounded corners, not worn down. When you wear it down, it's got a straight edge. It's almost like a right angle. But the other thing, getting to the denture system, is the Lifelike Gum Tissue. If you look here, each one of these is hand-painted. You can see where it's whiter over the tooth.
Yeah. It almost looks like gum recession on, I guess, on the right side of the picture on that canine tooth. So that's all by design.
That's Mother Nature's design.
Okay.
I don't know if I'd call that recession. The canine prominence, you know, the canine has the longest root of any tooth on the upper arch.
Okay.
You can feel it right under your nostrils. So you can also see the acrylic is very hard. They pressure inject this acrylic, so it's the strongest, the least porous of the acrylics. On some of the other dentures, I happen to have one here that shows a denture that is more commonly found. Comparing that to this, you can see the detail right where the tooth and the gum comes together.
Yeah, so it looks real.
One thing is, these dentures age. They age a lot more gracefully because they're harder.
Okay. What does that mean, though?
The system that they use to inject the acrylic into the denture, it's pressure with temperature over time.
Okay.
Okay, traditional dentures are more porous than these.
Okay.
This is a premium product. This is what is running around out there now. It's more likely to pick up bacteria, fungus, and the smell that goes along with it.
So these dentures become kind of like an odor.
Right.
Whereas these are less likely to get that.
Correct.
Okay.
And then if you put in the fact that a lot of denture wearers leave their dentures in at night, then you can really start to get this thing going at a much higher level. So this is a better system to have as far as gum health.
All right. And a better fit. You say they're a better fitting denture.
Well, because of the porosity. And whenever you have a new denture made, it's going to fit better because it's reflecting the impression of your mouth at that point in time. A denture that's been there for 5 years, you're going to have lost some bone underneath there, and it's just not going to fit as well. I think the American Dental Association says every 10 years is a good amount of time for a denture. So when we start to make a new set of dentures, I like to learn from the set of dentures that the patient's wearing.
Okay.
I get floss, go right down the midline of the face, and I want to make sure the midline is with that floss line. Then I want to look at the eyes. I want to make sure that the plane of the teeth go along with the eyes. So I go from the pupils down to make sure that lines up. Another thing I measure from the nose to the edge of the tooth. If it's just 20 millimeters, that's usually somebody that's not showing much teeth in their smile. More traditional is 25. Now, like all generalities, It's a generality. There's always some poetic license in there of how we're going to change things for the better.
So there's a lot that goes into the design and the fit
right.
of these dentures.
Right. And the ultimate thing is when we do the wax try-in.
Okay.
Then we can tell how the measurements are working out. It's not unusual to wax try-in. Okay, we thought we had it. Let's just fine-tune it a little bit more. There's a lot of people that aren't happy with their dentures, the way their dentures look. Mm-hmm. And that's what they're coming to me for, to get a more natural smile, to show more teeth, and hopefully have better function.
So these are a little bit more, and we've discussed this,
right.
a little bit more than traditional dentures, but chances are these people are going to be having their dentures for a long time.
I'd put it in there's more value in these.
There's more value. So
right.
they're made better, they're less porous. Is it a better fit, in your opinion?
Yes, it is. It's a current impression, it's better material, and the way the teeth line up is better. So that all works to make it a better set of dentures.
So you say that you're changing people's lives. Because I know you said that on my last interview with, when you can take care of their gum disease. Do you see that with giving them a cosmetic denture?
Absolutely. Randy, we can discuss the dentures now, but I think the pictures are going to show exactly what it's doing.
Let's take a look. What else do you have?
Here we have a gal. You can see all of her front teeth are flat across.
Now this is a denture?
Yes.
Okay.
That's a denture. All the teeth are flat. The canines no longer have the points on them, and they're yellow. This is what that patient looked like afterwards. We even got a little bit more lipstick there.
Very nice.
I think the lipstick alone almost says that she's more confident in her smile.
Well, it's a very pretty smile. So they picked the denture. You have like 10, you have a catalog. There's 10 different types of smiles. Do I have this right?
I have 10 different styles, yes, but a lot of times when I ask, if I were to ask a patient, which one do you like? They always say, you're the expert.
Okay, so you pick a smile that matches their face.
I have had, some patients come in and they've got the one earmarked, the one they want.
Okay.
So I do get those patients. I'd say that's more the exception. Most people are coming in and they say, you're the doctor, you pick the smile.
And you have little samples, I think you said, in your office, and they want to try them in right there.
Right, which that's good for one try, and it's just, I don't have like hundreds of these.
It's not sanitary, I guess.
Right, so you do have to have a little bit of imagination. It's like a picture without the frame.
Well, this is a very good looking photo. It's very nice, these, this before and after. And when it's done, what does she say?
She's happy. She's got her smile. Randy, let me show you this next patient.
Okay.
This is one that shows the stain that you get with the old acrylic or the everyday denture.
So that's a denture. Wow.
Well, I think it's pretty obvious. I mean, what natural mouth would look like that?
Well, it looks like, I don't know, some kind of like metal crowns or something. To me.
I'm looking at the stain that's going around the teeth.
Yeah, yeah. Now that's a pretty bad denture right there.
Exactly.
Is that unusual that people let their denture go that far gone before they upgrade or get something else?
No, it isn't, Randy. They'll go years this way. It's just you don't see their teeth. And if you did see them, yes, this denture is worn and the acrylics picked up stain, but there's other things that catch my attention. They're showing way too much gum there. Here, we're not showing the gum, we're showing teeth. The size of the teeth, they're longer.
Very white, very nice.
They're white. Whenever we do something like this, and I always tell the patient, if somebody notices that you have a change, tell them you whitened your teeth. Don't tell them how, just tell them you whitened it. Don't say, I got a new denture. You don't have to go down that road. But we can get somebody back, give them back their smile.
So there's a lot, I mean, you said you can spot them out and about.
Yeah.
Bad dentures.
Well, but I'm a dentist. Why
do they put it off? Is it the expense or they don't know what's available? What is it?
There's nothing really alluring, romantic to the dental office. People come in because they know they have to do it. But it's easy to put off dentistry. But having said that, once people do it, quite often I get, why did I wait so long? I should have found you earlier.
Good. Okay, we're going to take a quick break. We come back, more of your photos. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
You can't put a price tag on self-esteem. And that's a biggie. But the other part is I don't even have to think about what I eat anymore.
Oh, very good.
I don't have to worry about losing teeth.
It's greatly improved my ability to smile and not be self-conscious. So it's been a great improvement to me personally.
Well, I was always, keep in mind this was 10 years ago. I was 50, my 50s, so it's always been self-conscious of it, and I'm not self-conscious about it anymore. Other parts of myself I'm self-conscious about. But.
Well, he did a lot of work, and which was great. It was painless, friendly, professional, caring. It was a really, it's a little strange, but it was a great experience. And everything is working out fine. I'm happy with the work. I have no problems. They're checked. I have no problems. I eat very well, and there's just no problems. I'm very, very happy.
I think the biggest difference is for years I'd gone really not wanting to smile, hiding my teeth when I smiled, and it gave me back that I could smile with confidence now.
It is by all means worth going through the surgery. The cure was 100%. I can't tell you the quality of life and how good I feel about it. It's probably the best money I've ever spent of any medical procedure I've gone through. I've really been satisfied. I'm in business. I talk to a lot of people. The confidence of knowing that I can smile, I can talk, and that people aren't necessarily looking at my teeth or my gums or for something unsightly. I just have a lot more confidence. I feel a lot better about myself. I feel healthier and better state of life.
And my job means I have to smile a lot because I'm a bartender, so I smile all day long.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about cosmetic dentures. With us today, we have an expert on the topic. He's known for the cosmetic dentures that he's doing. With us, we have Dr. Brendan Dwyer. Okay.
Okay, Randy. As we said, I brought some more pictures.
All right.
My life's work here. Here's a patient that had dentures. Kind of obvious. He had a lower partial with his canines, and you can see how the canines wore a reverse smile in his look.
And those are dentures, right?
Those are dentures.
Interesting.
But it's an upper denture that was worn down by natural teeth, and then a lower denture was made to that upper denture.
Okay.
So we did one that's got a lot more harmony to it. And of course we whitened them.
Very nice. Looks very clean.
I know you don't like the close-ups, but to me, the dentist,
okay.
This one shows it.
Okay, there he is before.
And there it is afterwards.
It's very nice. I mean, they do look real.
Right. I guess when the full face smile, you don't see it. I want to showcase what we're doing. But again, I'm biased.
They do look real. I don't think anybody can deny that they look real. It's very nice. And how long can they last, by the way?
We're looking about 10 years is a good run.
About 10 years? So these will last about the same as a traditional denture, but it sounds like the exception is that they're probably going to look better for a longer period of time.
Correct.
Is that right? Because it's a harder...
Right, and I believe the tissue is going to be healthier for a longer period of time.
And each, now, do they choose the color? I mean, can you choose, are there different shades?
Yeah,
So
I have one color that I think is too white.
Okay.
I have made a few of those, and I'm okay.
So there's 10 different, let me get this right. Okay, so the patient goes in, they have a denture, they don't like their denture, they go in, based on their face and their size, and you have models in your practice, you choose the authentic denture, this cosmetic denture that would look right for them.
Correct.
Is that right?
Correct.
And what's the turnaround time?
A little over 2 weeks.
Okay.
If everything goes smoothly. If we have to do another wax try-in, that adds another week to it. But again, you don't want to rush this. You don't want to drag it out. But quite often you get the denture at the third appointment.
Is the biggest giveaway with dentures, I don't pay attention to this as much as you do, it's the gums that look, I mean, these are hand-painted with yours.
Right.
The ones we're talking about.
Well,
is that the biggest difference as far as the cosmetic?
Everybody's anatomically different. You know, there's some people that have learned to control their lip so they don't show their gum. They have that kind of smile. Myself, I've got the reverse. I have to really work to show my gums. Well, I'd have to lift my lip up. But,
okay.
You know, so some people just anatomically show more teeth than others.
Okay, good. Okay, so what else do you have? What other photos?
This is a guy that had lower partial. He had it in his top pocket, and he was walking to his car, saw something underneath it, got up, got back in the car, was backing up, felt he didn't have his partial anymore. So that's when he came in to see me. So not only did we do fixed work down here for his missing teeth, we made him a new upper denture. Here he is, a much different smile.
All right.
You know, and he's one that said, I should have done this a while ago. He's glad he found me. And we've got a great rapport. Since then, I also have his wife as a patient. Okay, Randy, here's another patient. This is one that has had extensive crown and bridge work. Unfortunately, on the upper arch, it was failing. So we ended up doing a lifelike denture for her. And we also did an invisible partial down below. There's the after on her.
Very nice.
I think that's a great result.
Cosmetic Dentures. One more before the break.
Here we go. That is a negative smile. Whenever the back teeth drop lower than the
So the
front
curve
teeth,
is a negative smile. Okay.
right, as opposed to this kind of smile. Here she is afterwards.
Very nice. And that's a denture.
Yes.
It's very nice.
And here's another obvious denture to me, square teeth. And 20 years ago, you didn't make white teeth. Now you got white
It's
teeth.
very beautiful. Very nice. We're going to take a quick break. We come back, more of these photos. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I love my denture. I love my denture. No one even knows it's a denture. I mean, look at this one.
Look at that smile.
I mean, no one knows it's a denture. Everybody goes, oh my God, your teeth are so pretty. I had someone tell me that the other night at a bar. So, I mean, and I love it. I've never had to deal with adhesives or anything. It fits perfectly. I love it. I wish I'd have done it 10 years ago. I can eat again. I can eat anything I want. I mean, I even ate an apple the other day. I mean, I can't bite forward, but I mean, I eat everything they say people can't eat with dentures. I have no problem.
Good.
None at all. And I love my smile. People compliment me on my smile. And I have both of my children coming here now. So that tells you how comfortable I am.
I feel like I have a new mouth. It was the best thing I ever did. In fact, I told Dr. Dwyer today that my mouth feels better now than it probably did 30 years ago before I even had the major problems. So I would recommend, anybody that has, gum disease like I had to do this treatment, and you will be amazed.
I think the biggest difference is for years I'd gone really not wanting to smile, hiding my teeth when I smiled, and it gave me back that I could smile with confidence now.
It is by all means worth going through the surgery. The cure was 100%. I can't tell you the quality of life and how good I feel about it. It's probably the best money I've ever spent of any medical procedure I've gone through. I've really been satisfied. And, I'm in business. I talk to a lot of people with the confidence of knowing that I can smile, I can talk, and that people aren't necessarily looking at my teeth or my gums or for something unsightly. I just have a lot more confidence. I feel a lot better about myself. I feel healthier and better state of life.
It's greatly improved my ability to smile and not be self-conscious. So it's been a great improvement to me personally.
Finally, one day, I said, I want to go talk to this guy and see, and feel what he could really do for me.
Right.
And from that day on, it was like a start and finish, like I couldn't believe. People that had known me for years, I sit and talk to them now, and they go, they're trying to look at my mouth. What's different about you?
Right.
I used to have a mustache and facial hair and shaved that off. And that's what I told them. I took my mustache off. They said, geez. And they don't budge. Matter of fact, I have to be very patient taking them out without causing any injury to myself. Because they're in there for a long time, and they fit perfect.
Hi, I'm Randy Alvarez. You're watching The Wellness Hour. We're discussing cosmetic, natural-looking dentures. With us, we have the go-to guy when you want a natural-looking denture, Dr. Brendan Dwyer. Okay, you have a couple more photos.
Yes.
So these are lifelike dentures. I'm sorry, what do you call them again?
Cosmetic lifelike dentures.
Okay, all right.
That's the word.
All right.
Okay, gentlemen,
And that's a denture? Is that a denture?
That's a denture.
Okay.
Here's the new denture.
Very nice.
Not worn down.
Okay.
Nice white teeth. Here's a remarkable change for this patient.
Wow.
Again, that's
now
what happens.
That looks like a bad denture.
That's what happens when you have some natural lower teeth that are hitting heavy. That's why we've got the groove right there.
The crack in the smile. Okay.
This, get back to a positive smile line.
Very nice.
Here's one. Again, you can see the gum in the tooth. That's a
that's a denture.
A real popular area for the food to collect. It's right at the junction of the gum and the tooth. And that's what that lady has going on there. Here we're able to get the tooth up higher. You don't see the gum. You see some of the gum, but you don't see that interaction. And let's see, Randy, here's one case where we did the upper denture, we did some lower crown and bridge, and the patient wanted whiter. And here we go. We got white teeth, and there's no gaps. I had her open a little bit just so you could see the lower teeth.
Mm-hmm. So final message to somebody watching this show that doesn't like their denture and they want a cosmetic denture. What do you say to them?
I say, if you don't like your denture, come on in. Because when you talk, people are either looking at your eyes or your teeth. If you're not confident in your teeth, it's going to show.
Okay, good. Do you have financing available as well?
Yes, we do. We have financing, many different plans out there to help you get the teeth you want.
All right, great. I want to thank you for coming to the show. Always a
Randy.
pleasure. Thanks for coming back. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.